All right, let's dive in. Today, we're going on a pretty wild ride, following a tiny hero, a single pill, on its massive adventure through the human body. We're going to get into the science of pharmacology to see exactly what happens from the moment you swallow it. I mean, it's a question we've all had, right? You pop a pill for a headache and poof, a little while later, the pain's gone. But what on earth happens in between? Where does that little pill go? And how does it know exactly what to do? That's the big mystery we are solving today. Okay, so the science that unpacks all of this is called pharmacology. The best way to think about it is like this. Your body is this incredibly complex machine with just countless switches and levers. Well, pharmacology is the study of how a drug acts like a tiny, specialized tool, maybe a key, that finds the right switch to either turn a process on or shut one down to get a very specific result. So our pill's big adventure really breaks down into two main parts. First up, we're going to look at the journey itself, what your body does to the drug from the second it enters. You can think of your body as this elaborate obstacle course that the pill has to navigate just to get to work. Now, this whole part of the story has a pretty fancy name, pharmacokinetics. But what it really boils down to is the body's playbook for dealing with a foreign substance. It's not about what the drug does, but all about what your body does to the drug, how it moves it around, breaks it apart, and eventually kicks it out. And this journey, it pretty much always unfolds in 4 key stages. First, you've got absorption. The drug has to actually get into your bloodstream. Once it's in, it's on to distribution, which is like the body's highway system, carrying it everywhere. Then comes metabolism, where the liver acts like this master chemical processing plant, changing the drug structure. And finally, excretion. That's the cleanup crew, making sure everything gets cleared out. So just remember, in, around, broken down, and out. Okay, so our little pill survived the journey. It made it through the obstacle course and has arrived at its destination. So now what? Well, now it's time for part 2, the mission. What does the drug actually do to your body? This brings us to another big word, pharmacodynamics. If pharmacokinetics was all about the body's effect on the drug, pharmacodynamics is the total opposite. It's the drug's effect on the body. This right here is where the magic happens. This is the pill's actual job. So how does a drug even do its job? Well, it's actually more straightforward than you might think. See, most drugs work like a key designed for your cell's specific locks, which are called receptors. They can be one of 2 things. An agonist, that's an activator. This key fits the lock perfectly and turns it, switching a process on. Or it can be an antagonist, a blocker. This key also fits, but all it does is jam the lock, so no other key can get in and turn it on. Now, as we all know, not all drugs are created equal. Let's talk about something called potency. This is all about the amount of drug you need to get a response. A super potent drug is like a really, really strong spice. You only need a tiny pinch to get a huge amount of flavor. It's all about efficiency. But potency isn't the whole story, not by a long shot. We also have to talk about efficacy. This asks a totally different question. What is the absolute maximum effect a drug can have? So think of it this way. A potent painkiller might need just a tiny dose, that's high potency, but it can only ever get rid of a mild headache, that's low efficacy. Another drug might need a huge dose, low potency, but it's powerful enough to stop severe pain after surgery. That's high efficacy. Efficacy is all about the drug's ultimate potential. You know, understanding how a drug works is one thing, but using it safely, that's everything. So how do scientists and doctors figure out the rules of the road to make sure a medication is actually going to help more than it harms? Well, one of the most important numbers in all of pharmacology is the therapeutic index, or TI for short. It's basically a ratio that compares the dose that works to the dose that's toxic. A drug with a high TI is really forgiving. There's a massive gap between the amount that helps you and the amount that could hurt you. But a low TI, well, that means the line is razor thin, and that requires some very careful dosing. And right alongside the TI is something called the therapeutic window. This is that perfect dosage range, the sweet spot, where the drug is doing its job effectively without becoming dangerous. So when a doctor tells you, take 1 pill every 8 hours, what they're trying to do is keep the level of that drug in your body sitting right in the middle of this window. Of course, things don't always go perfectly to plan. We've all heard of side effects, right? That's an expected but unintended effect at a normal dose, like an allergy pill making you a little drowsy. But an adverse drug reaction, or an ADR, that's something more serious. It's a harmful and unexpected reaction, even at a normal dose.
It's a subtle difference in language, but a really crucial one when it comes to severity.
This incredible science didn't just appear out of thin air. It's the result of this long, fascinating evolution from what were basically ancient potions all the way to modern, high-tech precision medicine. So let's take a quick look back at how we got here. For literally thousands of years, medicine was based more on philosophy and ideas than on actual observation. But then, around the 17th century, that started to change as experimentation became more common. By the late 19th century, scientists were laying the very first foundations for how drugs actually work. But the real game changer, that came only about 60 years ago with what we now consider the gold standard, the controlled clinical trial. That's what finally allowed us to properly test if a drug was actually safe and if it really worked. And that brings us right to the cutting edge, pharmacogenomics. This is the absolutely amazing idea that we can study your unique genetic code to predict how you will respond to a specific drug. Why does this work? Well, your genes are the blueprint for things like the liver enzymes that metabolize drugs or the cell receptors that drugs target. It's a huge shift from one-size-fits-all medicine to something truly deeply personal. So the next time you take a pill, you'll have a sense of the incredible journey it's on and the precise mission it has to accomplish. And all of this leads to a pretty profound thought. We are now entering an era where your own DNA could be the thing that guides your doctor's choices. So I'll leave you with this. Is this kind of personalized genetic approach the true future of medicine?